हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JBN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in Jayoti Vidyapeeth Women's University, Jaipur. In today's lecture, we are going to discuss about the adventitious sounds while doing the examination of patient for respiratory system. During auscultation, we listen different types of sounds. Some are normal sounds, some are added sounds. So the added sounds are known as adventitious sounds. So let's start with a discussion about adventitious sounds during auscultation in respiratory system. Normal findings on auscultation includes loud, high-pitched bronchial breath sounds over the trachea, medium-pitched bronchovesicular sound over the mainstream bronchi between the scapulae and below the clavicles, soft, breezy, low-pitched vesicular breath sounds over most of the peripheral lung fields. So these were the normal breath sounds. We have bronchial breath sound, we have bronchovesicular breath sound, and we have vesicular breath sounds. Other than these normal breath sounds, we have added sounds known as the adventitious sounds, which refer to the sounds that are heard in addition to the expected breath sounds. The most commonly heard adventitious sound includes crackles, rhonchi, and wheezes. We have crackles, rhonchi, and wheezes which are heard during the auscultation of a patient. Typically classifying the adventitious or the added sounds are classified into three important parts: lung sounds, the sounds that are arising from the lungs; pleural sound, the sounds that are arising from the pleura; and other sounds. So we have lung sounds, pleural sounds, and other sounds depending on the site of origin. Lung sounds. These can be continuous sounds or these can be discontinuous sounds. Discontinuous sounds are usually intermittent, non-musical, and brief sounds such as crackles and rails. Continuous sounds are the musical sounds that persist in most of the respiratory cycle or throughout the cycle, both on inspiration and expiration. These include wheezes, that is high-pitched sound, or rhonchi, that is low-pitched sounds. Next we have the pleural sound. Pleural sound consists of pleural rub. It may be continuous or discontinuous. A pleural friction rub is almost always a sign of pleurisy. Pleurisy is otherwise known as the pleuritis, that is inflammation of the pleura. Pleural friction rubs are the squeaking or grating sounds of the pleural lining rubbing together and can be described as the sound made by treading on fresh snow. They can occur where the pleural layers are inflamed and have lost their lubrication. Other sounds includes crackles or rails. Crackles or rails are basically short, explosive sound, often described as bubbling or clicking noises. Next we have the wheezes and the rhonchi. Wheezes and rhonchi are continuous sounds that are produced by air buzzing through the large airways. They occur due to the narrowing of the airways either by spasm or by secretion or by extraneous compression. Wheezes. Now we come to the type of wheezes. There are basically two types of wheezes. Number one is monophonic. This is a single musical sound arising from the fixed, persistent, localized narrowing of the single bronchus by a tumor or a foreign body. So, monophonic means single. It is a single musical sound that is arising from the fixed, persistent, localized narrowing of the single bronchus by a tumor or a foreign body. Polyphonic sound consists of widespread polyphonic wheezes are commonest type, particularly heard during the expiration. It contains several notes of different pitches, therefore it is known as polyphonic. Monophonic means single musical sound. Polyphonic means many sounds at a particular time due to different pitches of the sound. Next we come to pleural rub. Pleural rub is basically a continuous rubbing or creaking sound that is generated by rubbing or roughened surface of both parietal pleura and visceral pleura and is called as pleural friction rub. The stridor, it is a loud monophonic wheezes that is associated with laryngeal spasm or brachial stenosis. Now we come to the other sounds. Other sounds are certain sounds that are heard following some maneuvers. Number one, we have succussion splash. Succussion splash is basically a splashing sound that is produced by the movement of fluid in a cavity or hollow viscous containing both fluid and air so as to allow the movement of fluid. Post-tussive suction. When the signs of a lung cavity are present, then the patient is asked to cough violently. A sucking inspiratory sound that is heard over the chest following coughing is known as post-tussive suction. So, what is post-tussive suction? Post-coughing, a sucking inspiratory sound that is heard in the patient is a post-tussive suction. Succussion splash is basically a splashing sound that is produced by the moving fluid in the cavity or hollow viscous, containing both fluid and air so as to allow the movement of the fluid. Next we have post-tussive crackles or rails. The crackles which are not heard during normal respiration but are heard following coughing is called as post-tussive crackles. They signify that the cavity is filled with secretion which are dislodged during coughing, allowing the air to bubble through the fluid or secretions, producing crackles or rails. So, post-tussive crackles or rails are not heard during the normal respiration, but these are heard following coughing, therefore these are known as post-tussive crackles. They signify the cavity is filled with secretions that are dislodged during coughing and allowing the air to bubble through the fluid secretions, and they produces crackles or rails. Next one is the important thing, that is the coin test. It is performed in case of hydropneumothorax when there is accumulation of water and air, excessive air in the thorax. Hydro means water, pneumo means air in thorax. At the junction of air and fluid, the metallic quality of the sound produced by striking one coin or the other placed on the chest can be heard appreciably at the diametrically opposite side of the chest wall. So what you are doing is, you are placing the coin where? At the junction of fluid and air, and then tapping one coin with the other coin and listening on the other side of the chest. The sound that is heard is a typical sound, and this signifies the coin test, especially in case of hydropneumothorax. So this was all about the adventitious sounds of the lungs. In the next lecture, we will be discussing about pulmonary function tests. This session was powered by Digital Version 2.0 Jyoti Vidyapeeth Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.